afternoon. My name is Frank Steffen. I'm the editor of Allgemeine Zeitung, and together with Tunahole Mongoba, we are bringing you the 24th edition of our Corona-19 update, which we've been bringing you since the outbreak became known in Namibia. And welcome, Tuna.
Thank you so much for joining us, Frank. We are here today to share our latest updates on information regarding the COVID-19 as mentioned by Frank.
Yes, and this is obviously the International World Health Day, which we have today, and later on in the show we actually have an interview with Dr. Sagu Moses. He's the local representative of World Health Organization in Namibia. So we've got an interesting show for you, but most important for now, I think, is there was a bit of a uproar because we are part of SACU, the South African Customs Union, and all of a sudden found that we are members, and because of that we cannot summarily import any medication or whatever. But then on the other hand, South Africa had put a ban on us and was refusing to supply certain medication. Now, Dr. Haufiko, Bernard Haufiko, he is obviously the national coordinator for COVID-19. He's been able, together with our foreign minister or Minister for Foreign Affairs, able to convince South Africa that they should open the border or accept that we make alternative plans. So if beforehand we had problems getting sanitizers and masks and even the ventilators and other stuff, remember malaria tablets being part, or medication being part of that problem. That problem is now sorted, and so within days we should be better off in that regard. Yes, and then we obviously also bring you our latest stats and slides. Tuno, you wanted to tell us a bit more about sanitizing first.
Yes.
I think we forgot about that, is it not?
As we commemorate World Health Day, it is important for our viewers all over the country to make sure that we stay safe and we involve ourselves with active exercising, eating healthy, taking your vitamins and your supplements, but also to ensure that we get that midday sunshine. So even though we are indoors and we are on a lockdown, it's important that we stay healthy.
Yeah, I think this is very important. We keep talking about it all the time, but it truly has to become a habit. You need to clean your hands all the time. It's not only whether you think they're dirty or not. You need to sanitize, and that's the big thing. Whatever you touch, you need to sanitize. So we've brought you some more statistics. Obviously, we still stand at 16, but in the meantime, obviously, 3 have recovered. So it's a good thing that slowly but surely we're upping our testing, but we're obviously not there yet. Theoretically, Namibia should be testing something like 10,000 cases per month. Now, we'll not even get close to that, that's for sure. But I think at the end of the day, with 16 cases so far, yes, we're all easy to criticize, but we must give the kudos to the government. They've reacted fast. Not everything has worked 100% well, but at least we're on our way. So there seem to be more slides coming up.
So in quarantine, these are people who are showing symptoms. There are 266. So we have 100 people in Windhoek, 40 people in the Hardap Dam, 22 in Grossbarmen, 65 in Katima Mulilo, and 39 people at the Rock Lodge facility. In isolation, we have 13 cases, and the people who are currently recovered and are discharged from hospital, we have 3 cases.
Yeah, and I think that's quite important. Here you can actually see on the map where we have our cases at the moment. They're still few and far between. I remember that a doctor at one stage told me the biggest plus point that we've got in this country is in the fact that we have a very we don't have a dense population, and that helps. And then we obviously started asking in our 3 main papers on the internet pages, and we asked the people what were they doing. It's between Republikein, Namibian Sun, and Allgemeine Zeitung.
And looking at the statistics that we have, it's important for us to note that a number of our Namibian citizens are actually working from home and are essential services as well, because they are the ones that take up the big chunk in the lockdown status.
Yeah, I think the interesting part here really is that 32% are involved in essential services.
Yeah.
And I remember that a number of people have been talking to me and saying, but the traffic is almost the same and there's so many people in the streets.
Yeah.
And this in part gives the explanation why you still have a lot of movement, because it just shows that many of us are contributing towards or are somehow involved in these essential services.
Yeah.
So yeah, this is quite important. And then we've started accumulating a number of slides. We want to give you some of the tips from outside. I think you are the one who wants to present the first one.
Yeah, definitely. In light of International World Health Day, we have a special message from international supermodel Naomi Campbell.
In at least 20 seconds, get your hands wet. And make sure you go on the top, soaked up, sorry. Make sure you go on the top, it's very important. And under the nails are very important because it carries over germs. For at least 20 seconds, lots of lather and soakiness, and then you can rinse off. Now, if you don't have running water, please use the 2p tank, but be very mindful to leave some for others. And then you rinse off. When you go to dry your hands, take your paper towel or whatever it is you're drying your hands with to shut the tap and then dry your hands so that you don't pass on any germs. Hope this helps. God bless you.
Yes, as you can see, all the people have the same thing on their mind. Sanitize, sanitize, and again sanitize. And in a similar vein, we've got another little clip prepared by Vera Adrian. You might remember her as a Namibian cyclist. She's also got a message to share.
Hi, I'm Vera Adrian, and I'm a road cyclist. It's very important that we show solidarity throughout this difficult times now. Our grandparents and great-grandparents went through war, so I think we will manage to stay at home for now. Let's all do our bit and we'll get through this together and hopefully come out stronger. Sending you all the health in the world and hope to see you outside soon again.
Yes, and those were the messages we wanted to bring you. But then we also obviously have, as per usual, our various video clips which we would like to present to you from our regions. Namibian Sun, Republican and Allgemeine Zeitung journalists going through town, visiting the various areas and finding out more and witnessing what's going on out there.
As a reporter, the pandemic, depending on how anyone should look at it, personally, I've looked at it from a positive point of view, because it allowed me to kind of reevaluate and try and be innovative as well. Like usually would film an event like this and have it like as a like pre-record it and then run it later on. But for now, we started doing live, which is cool, and it's something we never thought we could do, or me as a person thought I'd never be able to do, but we did it actually, and it looks cool for starters, and it's great actually. So what I can say is it was quite well.
In your community, tell us, how did you come up with this initiative?
Yeah, good for the opportunity. Actually, what used to happen is that I have several shops that are mini markets around Rundu community. So 2017 we started with a program whereby we used to at each community where I have a shop, I used always to take elders, 10 to 20 elders, plus also people who are with disability, so that they can benefit something from the shop. In the past it was not well, because sometimes, you know, we record maybe 10 people, but the day of giving the people turn up to be a lot. But this donation is supposed just to be the people that are surrounding the area, wherever I have a business. So at this case now, at this mini shop, actually every month we used to give something like that, whereby they used to come in the shop, they take maybe, for example, a 10 kg plus salt or oil, and then they go. They used to do it normal, and then their name already known in the shop, so they can come at any time, as long as starting from the first day of the month. But since now we have this challenge of emergency, we thought also let's also add a bit on what we used to give them, so that at least we can continue again giving them the little that we have. That's why you see majority of them, they are just elders and those who are having a challenge, let's say disabilities.
So how many did you cater for this time?
Yeah, actually today we have around 24 elders. 4 of them they are disabled and 20 they are just old patient people.
Do you perhaps have the total value of the products that were donated?
Yeah, exactly. They didn't give me the because I just tried to give them from the shop estimated. So I think it's around 5,000 to 6,000.
Okay, and just tell us in depth, what exactly did you give?
There's a bottle of cooking oil or sunflowers, a small plastic of salt, plastic of 2 kg of rice, maize meal, fish, toilet paper, washing powder, and we also try to give them some gloves and and masks, so that at least maybe when they go for public somewhere, maybe the bank, or they are going to get their money at Nampost, so at least they can also know how to wash their hands and dress up with it, so that they can also fight against the disease.
We also gave chips.
Yeah, there was also chips among them. Maybe they can go give it to their children. But sometimes, elders, they can also eat chips. So
Yeah.
it's vice versa. Yeah.
Okay.
Actually, what we are trying to do is that if business people are around the community, we are the eyes of the community. So if we can be able to do this everywhere where you find a business person, if you can at least give the half to the community, then that means you are going to reach the government somewhere halfway. But if this is just a call to other business people that are maybe local, if we can do so, then at least we can reach 2 or 3 people. But you have seen that we are following now the policy that we are having now for 1 meter and not gathering. But our people is difficult to educate them. But I think we have tried. If we went wrong, maybe we have learned about it, so that next time when we are having something like this, we'll try to educate them before we come to the time of giving.
And how has the COVID-19 affected your businesses?
Actually, that is a big issue now, because I have around 7 different types of business. I'm into construction, was my first business. I'm into education, it's also closed. Construction is closed. I'm into retailer, this is what we are busy now with it. It's also closed. But I suppose they're supposed not to be closed, but due to individual problems, that's why my mini shops, they are also closed. But I'm busy now reaching the right ministry to see how I can be assisted in order for my mini shop to be operating at this time. But all my businesses, they are being affected.
Okay. Thank you.
Makanga, ningawa watu waka bosi wasika menamo na niko.
She come alone.
Hata kama msi dola mwa
Ninga uzasi wa batele.
Katapila wiza. Tamboreni tupui mike mie iba mu batere. Ya. Tom taranyo. Gazeko tupu. Batera. Benedictus Muronga.
Moronga sana. Suwom.
Benedictus Muronga. Batera.
Hey, mwalimu na amebo. Uiza? Katapila. Karen so namaste kama kuna kusina. Oni mtanta zona kusana kama wako kani. Andu atundepo wani.
Awako yakwa na kenye neno.
So this is Havana Open Market, where on an ordinary day many residents would flock here to sell some of their items in order to make a living, but as you can see, it is closed due to the precautions that were set by the government as a response to COVID-19. All open markets have been temporarily closed, and the residents of Havana are adhering to these precautions.
Hi everybody, my name is Yandi and I am a journalist currently working from home. So working from home does have its advantages. For example, you save a lot on fuel, obviously, because you don't have to get up, get in your car and drive to work. You can just wake up and get to work. And you don't have to put in such an effort with your appearance. You don't have to put on makeup or dress nicely. You can wear your pajamas the whole day if you want to, which I am only not wearing for the purposes of this video. But working from home also has its struggles. For example, I mentioned earlier you can just get up and get to work, but that does take self-discipline that you need to practice, because it's very easy to want to sleep in late and not get to work at all. Also, you have limited resources at home, I'd say. For example, a journalist is, I don't have access to my work computer, so you are very dependent on your own Wi-Fi, so if that lets you down, you are in trouble. I do think it's important that those who can stay at home do so, because you may not know you are infected yet and you can unintentionally go around infecting other people as well. So if you can stay home, do it for your safety, for the safety of your family, for the safety of the public. So only go out when absolutely necessary, and then yeah, stay home, stay safe, and I think if you all cooperate, we can overcome this thing.
Yeah, as you can see, today's one clip was a bit longer, but we just felt it was worthwhile showing, seeing that you can clearly see people are trying to help in their communities, and it's worthwhile showing and nice to see, really.
Yeah, especially with the video from the open market in the Havana informal settlement. I think for me it's a bittersweet thing to see. Sweet because the people, the community of Havana are adhering to the regulations of the lockdown, but bitter because I'm thinking about all the families who are being sustained from the items that they sell at the open market.
And it really is like that. I don't think many people visit Katutura that often. I know that I have. And all of these open markets, whether it's Ukuriangava, whether it's Havana, wherever you go, it's always important to remember that this is where people buy their fresh fruit. This is where people are sitting who actually bake bread and then give it out as from early in the morning, around about 5 o'clock already sometimes. So don't ever underestimate the function of that market. It works for the people who are in informal settlements and need to make do with what they have.
Yeah.
So this is a major break, and just one little urgent reminder to all of us, especially if you're the operator of a supermarket, that you should try and not increase your prices at this stage. I think we've heard of a number of cases. Ministry of Trade and Industry has actually invited everybody to lodge complaints if there are.
They have warned against it,
Exactly, but there are likely to be a couple of entrepreneurs who want to make a quick buck.
Up the prices,
So it's sad to hear if that happens, especially when it starts touching the lives of people who already have to make do with less than they had before even. So, but talking of that, we had Ochone Tlage. He actually drove out to Dorabus, and I talked to him over Skype a bit earlier. Hi, welcome back, and we've got Ochone Tlage on the line. He's the journalist of Namibian Sun, and he specifically traveled over to Dorabus today, which is to the east of Windhoek, obviously. Hi, Ochone, can you hear me?
Yes, I can hear you. Good morning.
Hi, Ochone. Tell me, what did you find in Dorabus this morning? How's it going there?
As I can see, pensioners are busy collecting their pensions at the post office, and a lot of people assembled in this area. It doesn't seem as if social distancing measures are being applied as they should, because people are huddled quite close to one another. Otherwise, it's very quiet.
So there's not much going on in Dorabus itself now?
No, because I just spoke to a gentleman. He told me there's nothing to do, as most of the shops where they would usually be are closed. But I will go and make a turn at the shops and take a couple of pictures later, just sort of look and assess how the situation is on the ground. But there's a lot of movement at the post office I can see now, and only at the post office.
Yeah, and tell me, is the police involved in there or not at all? Because last time I looked, they said that they would actually try and put some pressure on the people to keep social distancing and all that together.
I don't see any law enforcement officials. I will try and turn the camera and perhaps the viewers can get a shot of what is going on here, but there are no law enforcement officials. If you can just see, the camera has been tilted to sort of give you a view of the post office.
Yeah.
And no law enforcement officials on site as yet.
Okay, and you didn't have the chance to actually speak to some of those people. How many more people do they expect, or is this more or less what is normally happening at month end?
I would expect that this is usually the number. It seems as there are about 60 to 70 pensioners that are on hand to receive their pensions.
And they obviously not only from Dorabus itself, but also from the area. I remember there's small little dorpies around and settlements, some of them informal, some of them even illegal. But I mean, this is where the people come from, is it not?
Yes, obviously, much closer, like areas like Stangwater. I would expect some pensioners to have travelled from there as well, just to come and get, and Ulandshorst to come and get their pensions here, because it would seem as it looks like quite a fairly big post office. So I would expect this to be the central point where people come and collect their pensions for this.
Yeah, I think it's actually the only post office in those regions. Tell me quickly, how was your traffic as you went out? Lots of traffic, transport, or even personal traffic? The farmers coming to town, anything like that?
On my way here was basically just the trucks that are transporting what would be deemed essential goods, and then there was a police vehicle that overtook me. But for the rest, the roads are quite empty.
Okay, now it's good to hear that people are starting to stay at home. We've got an interview later with other people concerned about this as well. So, Okhone, thank you very much. Remain safe. And yes, bring us a couple of more photos and video clips so that people can see what's going on in Dorabus, east of Windhoek. Thank you very much and stay safe. Yeah, as we can see, not so clear at this stage whether the authorities are really getting this pension payout under control. We last saw it in Moorfish Bay getting out of hand, people being shoulder to shoulder, nobody making space for the other because they're always worried about somebody jumping the queue. So I suppose it's the same thing in Dorabus, yeah. So yeah, sad, especially on this International World Health Day. And as promised earlier, here's the interview which I conducted together with Dr. Charles Sagu Moses. He's the local representative of the World Health Organization in Namibia. Hi, welcome back. As said before, we've got an interview today with Dr. Charles Segu Moses. He's the local representative of the World Health Organization. And seeing that today is the International World Day for Health, we welcome you in our studio. Welcome, Doctor.
Thank you very much for the opportunity to be here in your studio again. And this is a very special day for us because it's the World Health Day, the 7th of April. And this day and this year we are looking at the midwives and nurses all over the world. We would like to appreciate the life-saving role that nurses and midwives play in the world, and keeping all of us safe, keeping all of us well and protected. So I would like to take this opportunity to salute all the nurses, midwives, health workers in general in Namibia.
Yeah, I think at the time of COVID, this is obviously quite an important message because those unborn children need to be protected.
Absolutely, absolutely.
Talking of COVID, maybe we can stick to the rules and first sanitize. People, this is very important. We cannot stress this enough. Sanitizing, and again, sanitize. Wash your hands. Keep social distance and stay at home wherever you can. Don't mingle. It's not the right time not in this crisis. We should just stick to the rules. But coming back to why we actually wanted to talk to you, obviously you've got your main theme, but can you tell us a bit more? What is the World Health Organization currently doing in Namibia in terms of contributing towards these efforts?
Once again, thank you very much. And on this day, I think it's a good opportunity to really reiterate some of the things we've been doing for the past 30 years since Namibia's independence. The World Health Organization has been in this country for that long. And we have been helping the country to, first of all, expand health services, to make health services accessible, affordable. We are talking about universal health coverage to all, especially emphasizing on the most vulnerable, to ensure that no one is left behind. And this ties in very well with the Harambee prosperity plan. It ties in with the NDP 5 and of course the SDGs. And we have heard over and over again that the president of the country says that nobody should be left behind. And so far as health is concerned, this is one of the major contributions. We are helping the government through the Ministry of Health to ensure that everyone everywhere has access to high quality, affordable, which is financially and geographically accessible.
Yeah, I know that's one of the SDGs is always accessible health to everybody and especially affordable health to everybody.
Absolutely.
So how do you approach these sort of projects when you start off with them?
So there's the first major contribution. The second one is to keep or to protect the people of Namibia from health emergencies. And as we speak now, you are aware of the COVID-19, which is a major health emergency. And I just want us to see that it's a pandemic which at the moment we have over 1.3 million people globally infected. Over 70,000 people have died. And it's in almost every country. Over 200 countries are affected, including Namibia. And as you are aware, in Namibia we have about 16 cases. And really, it's something that we all need to work together to ensure that we get it out of the place. And this is one of the major things that the WHO is doing to help, first of all, prepare the country, or so that the country becomes ready. And so about a year ago, we helped the country to develop a national public health emergency strategic plan. And this plan is what has been rolled out during this emergency.
So this has all gone according to plan so far?
To a very large extent, to a very large extent, because the plan was already there, and so it's the specifics that had been plugged into, and some of the key areas in the plan are really to first of all isolate. To isolate those who have the cases. So if you suspect someone who has a case, to test so that you know the person you've isolated is either positive or negative. Once you know that, you treat the person. And then when you treat, then you also trace the person, those who have been in contact with the person. So that you can then ring fence the person and their contacts. So you
but
hear
is that not one of the biggest problems that we have at the moment in this country, is the fact that it seems as if our testing really is very tedious. It's either a time-consuming issue, number one, and number two, there are not as many as we should ideally have. Is the World Health Organization contributing, trying to help us in that respect?
Okay. About testing, for example, we helped together with the Robert Koch Institute of Germany to provide the NIP, the reagents that were used in doing the testing. Robert Koch, in addition, helped with the training, so we have people who have been trained, to do the tests here. The testing, each country has a criteria of who to test depending on the level of the pandemic. So for instance, if you are having imported cases, then the criteria for testing is you have the symptoms, but you also need to have a history of travel. Once the cases become community transmission, then you find that somebody who may be positive would not necessarily have traveled, but would have been in contact with somebody
in Namibia
who may have been in contact with another person who may have traveled. So if you say only the travel history, you miss out a lot of cases. So it also evolves, and I think this is what is happening. And of course, we are pushing for more tests to be available, because once you're able to do that, you become more certain. As I mentioned earlier, the strategy is once you isolate, you test. Because
so far we're still on track, even though we might be lagging a bit on the testing.
Yes, we are still on track so far as the strategy is concerned. Because once you isolate, you test. And unless you test, you don't know what you are dealing with. And then, as it evolves, you find that you change the criteria of who should be tested and who should not be. Because some people have said, okay, test everybody, but you also have to be realistic and practical. So we test those that we suspect are likely to have, and then we know once we test, we treat.
So how did this whole COVID-19 pandemic, how did it affect the World Health Organization personnel itself? Were people sent back home? Did they remain in the countries wherever they are? Are they actively involved in rolling out these plans, or are you actually also mostly working from home, as many do these days?
Well, basically, the whole of the UN, and for that matter, the World Health Organization, we have the essential staff at work. The rest are working from home. However, for us, because of the pandemic, all our staff are essential.
Yeah, because you're technically on the medical side all the way.
Exactly. So we are actively engaged. We are working hand in hand with the Ministry of Health in the Emergency Operations Center. So we are there. We also have brought in experts to come and help what the ministry is doing. So we really are here hands-on to try to the best of our ability to ensure that we bring this to a quick end.
So I suppose you've got your places where you get support from. Where does Namibia get most of its technical support right now?
Right now, we are there, WHO and other partners, UN agencies, CDC. So these are the technical partners helping the ministry to implement their plan. So the ministry, first of all, came up with the plan to first prepare and then respond. So, and this plan, we contributed, to it. We helped the ministry, and as we brought in experts to come and ensure that we are going according to plan. We're making sure that the people of Namibia can be safe, can be protected from this pandemic.
So technically what's happening now is, to a certain extent, with the rollout of your plan, there's a bit of learning by doing, because surely you are now following this with a keen interest, and I suppose recording it to see where adjustments need to be made to the strategic plan. So how will you assist Namibia to make sure not only to get through the COVID-19 crisis, but also for future, what I'd like to call super viruses that might arise, because those type of viruses have been on the cards for many years. It's now arrived in Namibia, whereas in the past we have always been lucky and not experienced them.
You know, this virus is a new virus, and so we are learning a lot as we go on, as it evolves. So that's one, and that what makes your question very important. And so what we have learned from this virus, we, of course, are documenting to help us in the future so that, we can be ahead of the curve. Now, let me say a bit about the virus, the kind of speed and severity of this virus. I mean, that, for example, about 3 weeks ago, in fact, I was here. I did an interview here about 3 weeks or so ago. And at that time, we were just looking at over 100,000 people infected globally.
Yeah.
Now we are talking about what?
1.2.
Over 1 million. In less than 1 month. Actually, 2 or 3 weeks.
2 weeks quadrupled,
yes. Yeah. You see? So this virus comes with that speed that perhaps we haven't seen before. It's also very smart in terms of even who to attack and the people that the virus is killing and the most vulnerable people. Look at the spread.
So it's going for easy targets, yeah.
Exactly. You see, and then it's all over the world. All over the world.
Yeah, I think there truly can't be anybody who's not affected at this stage.
And this virus has no respect for anybody.
Well, as we can see in England.
Yes.
Or Canada, for that matter.
Yeah. Has no respect for anybody. Whether you are this or that, the virus comes at you. And this is why I think it's important for all of us to work together. So one of the recommendations that WHO gives to countries is that this is not only a health issue, it's all government. And I'm happy that this government has taken that very seriously. So the declaration of the state of emergency, even the lockdown, it's all in that spirit of let's all come together as a government to ensure that everybody is contributing to it, because it affects everyone. But also, it's a whole society approach. So public sector, private sector, everyone.
Well, we're all in it together.
We're all in it together. We're all in it together. And that is the only way we can quickly stop it. And we are better off stopping it early. And so, with the kind of speed and ferociousness that the virus attacks, we also need to respond accordingly.
Have the same speed and dedication. Yeah.
Because if we relax, it will be disastrous. The good thing is that we can do something about it if we all pull together. So there's hope. And we have seen this in other countries that were surgical in their approach, that things can be done quickly, together, and at a massive force.
Yeah, to get a sudden stop to this thing.
Exactly. So you attack it. It's like, you are killing a fly with the
swap.
Yes.
Yeah.
Yes.
That's talking of sudden stop, that basically brings us to the end of our allowed time. Dr. Segu Moses, thank you very much for coming in and sharing on this important World Health Day, sharing this message with us all, and actually giving us some hope, especially seeing that there seems to be a system behind the madness. Most of us don't always seem to be able to follow it, but as you heard today, there is a strategy after all. So thank you very much for coming in, and I hope we all master this challenge at the end of the day.
Okay, thank you. Thank you for the opportunity and the fact that, yes, there's hope that we can all look to working together, and on this World Health Day, we can really protect ourselves.
Wow.
We can protect our families. We can protect the most vulnerable in society, which are the people above 60 years and those with underlying health conditions. But above all, we can protect the health worker because they are our frontline workers. They are the ones who are fighting, for us.
Yeah, and taking risks.
And taking risk. And so if we can work together to ensure that these 4 areas of protection are addressed, then I'm very optimistic that we can overcome. Thank you.
Thank you very much. And you have a nice day.
Get up, sunshine, move on, that feels so good to me. Get up, sunshine, move on, bring back good memories. Get up, sunshine, move on, that feels so good to me. The way you
Right, that was Dr. Charles Segu Moses, the local representative of the World Health Organization, giving us a bit of a background as regards the involvement of WHO in Namibia, especially on this day when the day is dedicated towards our medical and nursing staff. Right, and now we get over to our normal inserts.
Yes. For our next insert is going to be kids active with the COVID-19, and then we're going to share some couch tips.
Good afternoon, everyone. My name is Crystal, and I would like to share our daily couch tips with you. So first of all, let's start by sanitizing our hands. So we need to remember that this is part of our daily routines now during this lockdown period. I just indulged myself by reading one of our Tourismus magazines. If you'd like to have this magazine in front of you on an online platform, please visit our Tourismus website. You'll see the link below, and please enjoy this. There's a lot of Tourismus magazines that are archived on that platform. Also, just remember, we need to always keep our mouths moist. Drink some water after every 10 minutes or so. Keep hydrated. So for our couch tip today, I'd like to share with you our yoga couch potato tips. So all I'm going to do is I'm going to put my one leg over onto my other leg on top of my knee, and then I'm going to keep my back straight. During this process, remember that we need to always breathe in and out, nice and deep, and slowly out. And then all I'm going to do is I'm going to roll my foot around. So while I'm keeping my back straight, I'm going to roll my foot around. What you can also do is you can massage your foot while you're at it, because this is going to get some blood flowing through to your legs. And you can just repeat it on the other side. As easy as that. If you have any tips that you'd like to share with us, please WhatsApp us on 0811 7010. Thank you for watching us, and stay tuned for our next session, and be safe. Goodbye.
Yes, and in this time of challenges, let's also stay positive. As usual, we have brought you some pictures as well, or bringing you some pictures. This time, the one is just being titled Yuma. One of the ladies sent us a photo of her sitting next to a swimming pool, seeing that she can't go to fish at the coast, she'll have to do with a swimming pool. And then the other photo, which is also very nice to look at, is on the way to Stumpy. Rian Stadler took this photo. Obviously, in this time, we normally are totally happy to see this sort of sight. And it somehow goes past us, and we don't really register it anymore. Just a few months ago, we were glad about every drop of rain. And now all of a sudden it's just COVID, COVID, COVID all the time. Not that I say it's not important, but I think it's important to also remember that we've got a lot of good going on in this country.
Yeah.
And in that vein, thank you very much, Tudor, for joining me today, and thank you to all the viewers who have listened to this long live broadcast. Hopefully we'll bring you some more news tomorrow at the same time. Well, and stay healthy.